workforce of Vihiga Referral Hospital, do you have enough doctors? Because sometimes there were reports that you had to get doctors outside. Sometimes a patient would come, there are no specialized services and specialized experts. Do you agree that that is what was the situation, or is the situation, or if there's something you're doing towards that?
As I've said, I've been given opportunity to make decisions. Yeah, it is true we've been having shortage of staff here and there. And you know, being a specialized hospital, training, teaching and referral hospital, one thing we must have adequate staffing, and especially specialists, because we're also training students like Kaimosi University. There are students who are doing medicine or nursing. They're coming to that place, and we must have a workforce commensurate in terms of skills to the requirement of the university or colleges. So one thing, we have good number of specialists, but within the 3 months I've been there, you know, specialists are people who are shared. Yeah. We share. You cannot say that he must work here every day, because their services are needed elsewhere. So I've engaged with the support and approval from the governor on locum, a number of specialists. When I went there, or when I came to this facility, we didn't have actually, for example, specialties like pediatrician. And as I speak now, we have a pediatrician who is working there. You know why I started with that? Our babies are vulnerable.
Because there were reports that Vihiga was losing a lot of children.
Yes, yes. In fact, right now, that is true. But I can assure you, since I came, referral out of babies, unless it's a very serious thing, we can't. In fact, last month I was looking at, we only had one referral out, but we had a number of referrals in. That one, it tells you that there's something we are doing. Because if we can ensure we take care of our babies at the facility, and that is what I want, because referring babies out is expensive to the families. So for sure, what I can tell you, that we have reduced on those referrals. In the same department, I've looked for, because I realized that when we have a pediatrician, yes, there are some cases also which needs still on babies, surgeries. So I've also looked for a pediatric surgeon who has also reported is working. So, you know, I'm trying to reduce on unnecessary referrals. So these people are there, they are on call, they come physically. So that one with the babies, I can assure you, we are good to go.
Now you're getting more locum in, you're getting this specialist on locum.
Yes.
Why did you sack the interns who are on locum?
The locum, that one there was no, I can tell you, I can't be blackmailed. It reached a point where I was being blackmailed.
No, they said you had not paid them.
No.
Because you had not paid them, the hospital had not paid them. When they asked for salaries, you chased them away.
Do you know, there were the costs of delayed payment.
How were the interns the cost of delayed payments?
Let me tell you.
Tell me.
When I went to that hospital, or to this hospital, you know, today I've just come from Senate. Yes. What took me there is audit report. So there are some things which I can avoid. So when I went there, the thing was, there are some statutory deductions which were not being deducted. And that is an audit query. When I pay you withholding tax, 5%, I must deduct. I must pay for you SHA, so that when you are sick, actually you use that SHA for you to be treated. Because when you are sick, how will you be treated? How will you get services? Then people who are in the bracket who pay as you earn, pay, you must deduct. So when I told them that, now they started blackmailing me, bringing me. Were they not being deducted? No, they were not being deducted. That's for fact.
So that was a contravening of the law.
And that is what they wanted. That's why I'm telling you those are cartels.
So you told them you want to deduct them?
Yeah, I told them. And then they told me to wait.
You wait until they are ready?
Until they are ready. Then I told them, okay, let me wait. When you are ready, then I will pay you your salaries. Then they went to the union. The union talked to me. Then the union, I asked them, do you know the work of the union is to look at the welfare of staff? I, as our CEO, is to ensure that I comply with the statutory deductions and requirements. Because do you want me to wait? I invite auditor to come to tell me what I knew, to point out on what I knew very well.
So did you sack these people or they sacked themselves?
In fact, they sacked themselves.
How?
They refused to come to work. And then do you want me, because the reason as why they didn't want to come to work, so that they could paralyze services in the hospital. And I mean,
They were protesting non-payments.
Non-payments, I've told you.
And you're waiting for them to give documents so that you can deduct before you pay.
Yes.
So you delayed their salary because they had
No, they delayed them. In fact, they refused to produce the documents. When they refused, I asked myself, do they want salary? Because it was not optional. And I could not break law, so that I appear in the Senate next year to answer what I knew very well that this one was against the law. So I requested them, bring your documents, I want to pay you. Then they were dilly-dallying. Unfortunately, you know, they are competing tasks. Then now they had to wait. So what they did, and you know, they were getting advice from people who are permanent, staffs who are permanent. One day I realized there was a letter which was written that we are giving you 1 day, failure to which we are going on strike. And what is locum? Locum is not a permanent employment. It's not a contractual. Locum, you come and work as and when we need you. We pay you your money, you go home. But it's just because in government we don't keep money in safes. That one was something which was being used to happen many years when we were still young, when an officer could just carry money in boxes and then put them there. So we accumulate the payment. That's why we pay them at the end of the month. And ideally, locum, we call you when we need you. But now they realize that we have engaged them. Actually, we have over-engaged them. So they thought they were on permanent basis. So they started telling me that they want to go on strike. A locum, somebody I can call you when I want. When I don't want your services, I tell you now to do today, I'm okay. Or they relieve staff when, for example, a staff has gone on leave, and then I'm realizing that there's gap because leave, staff must go on leave to avoid burnout. Then I call a locum to come and fill the gap. Once that staff comes, we tell them we'll call you next time.
So did they strike?
Yes, they went home. So when they went home, I told them, see you next time.
Stay home.
Yeah, stay home. And in fact, in their letters, I told them I will pay you all the monies you worked, all the days.
So have you started paying them?
In fact, the ones who went on strike, I've paid them. I've cleared. In case there is
Did you deduct?
I deducted.
So they finally submitted the documents?
Yes. Those people who did not submit their documents, I didn't pay. So if they bring their documents, I pay. But as far as I'm concerned, all of them brought, because they were testing me. So they had to bring, and I paid them.
Can you have the mercy of the heart and call them back, now that you have the documents?
No. In fact, those ones, you know, there are very many young people who are looking for jobs. And you know, when they are corrupted, in fact, let me tell you something. Those guys were brought there, and especially in some strategic department, to blackmail His Excellency the Governor, so that whenever the permanent staff wants to do funny things, they tell them to go on strike so that that department is paralyzed. And this one was happening at the casualty. Imagine accident and emergency, where we take care of people who are involved in road accidents, people who have emergency cases. Then now you go and take all locum staff in that department. So that one I've since changed. I've mixed permanent. In fact, permanent should be on the higher side, so that when we have emergencies, then they are attended to those guys who are on permanent and pensionable. So that those gaps which are in other departments, that's where I put locum. But your question is, hakuna mtu anaweza samehe, because they were also being used. But they are young people. Some of them have been using people to come to me to ask whether they can come. In fact, they are now admitting that they were cheated. Even the letter they wrote, it was drafted by a permanent and pensioner staff. So they have told me.
So you've really had a tough time.
Yeah. So no, that's my work now. So I can tell you.
Let me ask you about how much do you guys collect, and if the FIF is working for Vihiga?
Yeah, FIF is working, and you know it can't work if machines are down, because those diagnostic services, especially radiology, where we get CT scan, where we get X-ray, where we get ultrasound, those are the services which can help the hospital to generate revenue, and then lab. And the reason that's why I started with the radiology. First of all, we can't admit a patient without diagnosis. And diagnosis is determined by the radiology department and lab. So I'm revamping radiology and lab. And that's where we get resources. And that's what brings people to the hospital. You cannot admit a patient in the ward if kama ajui kama ataenda operation ama ajui ugonjwa gani, so that an action plan is
Is that in action now?
Yes, for sure. So for now, I know we have improved our revenue collection. The only challenge we have is, now most of our patients are on SHA. So when SHA has not released the funds, then you'll find that we have challenges here and there. But we are constantly engaging SHA so that they can be releasing money on a monthly basis.
How much does SHA owe you?
For now, you remember when I was at the Senate, the same question came up.
Yeah.
And, as a serious and senior manager and administrator for many years, I want to have a process of verification with the SHA, because there were some pending payments which were there before the defunct NHIF was in place. So we just going to have a sit down with the CEO of SHA so that we can verify through reconciliation, so that I know this is the figure. So next time I will tell you this is the figure exactly.
Now, how much do you guys collect in a year or in a month?
In a month. In a month, personally, my projection should be 30 million.
But how much do you collect now?
For now, when I came, you'll be shocked. You'll be shocked.
How much?
We are not collecting revenue.
What do you mean?
Yes.
So by November last year, Vihiga Referral Hospital was
most of the revenue are going to the staff. The things you said, we refer some staff because we have commission. Somebody is just messing up a machine to refer a patient to another facility. So that but they are given commission if you refer.
So now let me get there. There were staffs in Vihiga Referral Hospital who they would get a patient, they refer the patient to a different hospital.
Yes.
Then the patient will go there for the services.
Yes.
And the person will get a commission.
Commission, yes.
And is an employee of Vihiga Referral Hospital.
Exactly. Exactly. And then others, revenue, those people who are collecting cash, are also picking money from patients. So it was like, that's why it was very difficult for governor to know what exactly is ailing this hospital. And in fact, you remember before I came, when I started being tough, I was threatened by strike. I told them, go. You can go for as many strikes as possible, provided that, because I know also what they do. So I will also tell them. In fact, I will call the media guys. I tell them so and so. This is what is doing, and I told them. So I told them before we go on strike, come and clear with me the things you've been doing, because others have been neglecting patients. Others are doing their own locum. Then they don't come to work. So in fact, I dared people so that they just go on strike, because there's no reason why you should go on strike. If it is promotion, they were promoted. If it is whatever salaries, I think they get salary on time. So why should working environment? I'm striving to get equipment to ensure that each and every person is facilitated to do their work. And you guys were, even if one drug is missing, people forget about everything you are doing. They talk about that one drug. And it starts with the staff. Some can come up with a message. They draft a message. They send to a blogger, so that blogger can move around. There's a day I asked one of the bloggers, do you know what you're talking about? Because it was a misleading information. So, Mimi, I'm here to work. And those people who are not willing to work, they should come and excuse themselves to go and joke around elsewhere.
About the no revenue collection, and that actually hit me hard. You have now a projection of 30 million a month for Vihiga Referral Hospital. There is an audit that I saw. There was some of your responses when you talked about 149 million collections in a year. That translates to about 12 million. What was that?
In fact, that's why I was telling you that we are not collecting revenue. That hospital, with the services we offer, with the specialists we have, you cannot say that we can only collect 12 million per month. That's a joke. So each and every person must just pull up their socks and also be ready to work. My work is to avail consumables, that is non-pharmaceuticals, pharmaceuticals, lab reagents, and equipment. And also where there are gaps, we get staff. So, and then we will generate revenue, because we are also not in your business, but we must do what is called revolving fund, where patients pay, then we buy whatever we need.
What is the capacity of Vihiga against the demand of service? Which major services are offered in Vihiga?
The capacity, I think we still need to think about the capacity, because when you look at the number of patients who are flowing, we need to expand. But I'm happy we are going to address that issue of capacity because of the new plaza which we are coming up with, because we have an additional theaters, we have additional even renal dialysis machines which we are going to add, and then we are also serving. I told you that let people talk. Neighboring counties, patients are coming, and they are coming. And one of these days, I will just want to get the data of patients coming from neighboring counties. Is when you will know. Because these other counties, people are quiet. In fact, there are counties I know where people are quiet, they don't talk, but there are no services. But here, we are getting services, people are referred to our facility, then people are talking, you see.
People who claim Vihiga refers patients to dispensaries.
Just give me one.
No, but that's what.
Okay, in medicine, there's also, we accept reverse referral.
Okay.
But reverse referral is where you've taken care of whatever services you're supposed to give. Now you think this patient being in this facility is expensive for nothing. Let them go, even maybe it's just dressing or whatever. All those people on palliative care. Yeah, you know very well this one can be attended to in a facility near home. So, but referring a patient because we lack something, that's why we are referring to lower level. That is even illegal. So if you get such a case, just give me one. Then we'll deal with whoever referred, and they will tell me why they referred. And I've told them, before you refer patient, like I started with babies, before any baby is referred out, I need to know. Even if it's an emergency, let them, I'm a phone call away. And there's a platform where everything is reported. So I will know. And I give a go-ahead so that the reason why that patient is being referred is authentic. Yes.
There has been claims that there are long queues at the Vihiga Referral Hospital and reported drug shortages. There are long queues there. And sometimes the patients, when they come, even in an emergency, they're told, let's first of all sort SHA while they're on emergency. Is it the case?
In fact, one thing I need to introduce what is called customer care desk. That is a challenge. You know, some of our staff, because of attitude, and we will train them. Sometimes some people, when they're not used to another different way of doing things, what will it cost just to tell us, a patient, that we have this challenge, just wait. Like there's a day, there was an outcry. We had an issue with the system. SHA was down. Nobody was explaining to the patient that just give us some time. And I'd called even the SHA headquarters, and they assured me that they are sorting it in a few minutes. So nobody could explain to the patient that we have a challenge. I had to send somebody to go and the patients are not bad, by the way. They listen. So when they listen, in fact, the only thing they were worried about is people should not now jump the line. That's what was their worry. And when we see cases which are emergency, we cannot line them. That's why we do what is called triage.
Do you put patients on hold until SHA reflects?
No. In fact, that's what I was going to. Triaging. Triaging, you look at, there's a nurse who's supposed to be in a place called triaging. You look at those patients. Now, who you, at Angoja line, who you is an emergency. So we pick them and then I go and attend to them on priority basis.
Is it happening or is it just hearsay?
I think it is happening. Yeah, I think it should happen. And if it is not happening, I want to invest in Wananchi now, because they are the ones who will give me exactly. And when I get information, provided it's not a false allegation, yes. If it is the correct picture on the ground, I will always act. And one thing, my phone will always be on until the day when I'll be comfortable that our people are served properly.
Maybe 2 words, this is the last question here. Generally, looking at Vihiga, looking at the referral hospital, the biggest challenge right now is what? And what do we expect in the next 1 month? Or maybe in the next 1 year?
The biggest challenge is just negative publicity, which personally I'm going to work on it to to see how best. You know, one thing, the funny thing with the hospital, ideally you are not supposed to advertise. Because when a patient comes, they will go and tell other people that I got services, there are drugs, or there are no drugs. So I want to ensure that I avail all that is required. Then after that, patients themselves will go out there to tell people the kind of services. And besides that, I'm going to invest also in the mechanism of how I can communicate this to people. Yeah, there's something I left. You know, when I came to this hospital, dialysis was not being done.
Oh,
Yes. And you know, the machines were there, 5 of them.
but there was no dialysis.
And machines, just small things, which broke down. And now they were not working. In fact, there was only one machine which was working. And even there's what is called water treatment plant, which those machines uses, was down. So when governor gave me opportunity to do what I know best, we brought 5 new machines, dialysis.
Oh, dialysis machines, 5.
They are working. In
When
fact,
did they come?
Early January.
Okay.
Early January.
Oh, this year.
Yes, this year. And you'll be shocked with the number of dialysis sessions we've done. I'm very sure we are over 200. Those are people who are just suffering. In fact, going to as far as MTRH, and you know, the fare, accommodation, because you know you are dialyzed twice a week, and it's not a joke. In fact, those patients are suffering. So those are some of the areas when I realized that, I said this dialysis must wake up. And people are happy, I can tell you. And they're there. Those patients, one of these days, if you find them, they will tell you their story. Leave alone those people who are just yelling up and down. One day when they find themselves in the condition where these patients are, is when they will come and give you a story. Right now, we let them just talk. Because maybe they have been hired, they are being paid some pennies to talk about how Tichilo's government is not working. But when they find themselves, they will come and tell a positive story because they will get the services.
Have you received the threats
Threats?
from leaders around, maybe political leaders, that you touch Kamariki in that section, we are done with you?
No, the staffs are the ones who know. You just see the body language. The body language is like, if you do this, I will tell a politician. But to be honest, there's no politician who has threatened me. But why should you threaten me? Why now?
Because you're touching my people. I've stationed them there for a reason.
When you get sick, you will come and they will help you. The people, because it's when you will know what I was doing is right. So let us, each and every person do his duty.
With all this negative energy around Vihiga and bad publicity, as you put it, what do we expect in 3 months, 6 months, and 1 year?
I can assure you, people are going to come to Vihiga for treatment because my focus is service delivery and how to improve it. In fact, after my tenure, I will come back. In fact, people will tell me, you know, just sometimes when you're in a place you are not good, but when you leave is when people will start telling you that you are good. They will realize your goodness when you are not there. So in the next 3 months, I can assure you, I know we shall have launched the new plaza. We shall have expanded our services because the demand is growing. So we want to get new equipments. There's a machine I'm going to get, in fact, latest next month, which makes patients move to MTRH, to Kisumu. It's called laparoscopic tower. And I've agreed with my surgeons. I'm even going to get different surgeons to come so that all these surgeries can be done using the new technology. So laparoscopic tower is coming. And then this year still, I will have to bring MRI machine. MRI will have to be there. Right now, our patients, when they want to MRI, they imagine if it is not Jaramogi, then they go to MTRH.
But it will be in Vihiga this year.
This year it will be there. I can assure you that one it will be there. And the county is not going to incur any cost. I know what we are going to do, and the governor is spearheading that.
Okay.
Yes.
Get one question here because I wouldn't go through many other questions. We can answer them in the next session. She asks, this new morgue, Pia Ikona Ukora, it's very classic. It has a VIP and a VVIP, but collection goes to personal pocket. And she continues to say, ask him. For me, I paid on a personal account before my mother was there.
She's very right. Very right. That one, in fact, that's one of the people I can really applaud for having said the truth. When I went there,
Yes.
there are charges. We have charges how we charge mortuary services. We have registration. We have embalmment. When you go there to preserve your body, we use chemical, that's formalin,
Yes.
to embalm. You are injected so that to preserve.
Yes.
Then there is you decide whether you want to go to VIP or VVIP or general. Then there is what is called dressing. Those are charges. So this dressing fee has been 1,500. This money has been going to people's pockets. And in fact, if you ask her, whoever said that,
Yeah.
that is the money she's referring to. In fact, you ask her if it is 1,500. That's why I've said it's correct. And I've since stopped that. I've received delegations from people you couldn't even believe. This money, which means it was benefiting very many people. So I told the mob guys, you stop it. And in fact, when you look at finance bill or finance act of the county, it is clearly stated, including postmortem, including the making the face or whatever. It is there. So why should we let other services be charged by individuals? And when you say stop, then they run. There are others who have even gone to politicians, and I'm waiting for those people to come. Because if they had shares, then I'd be sorry to them and say, now you had shares, now Fireji Mekatika. So that lady is saying the truth. And
Is this still happening? Do we still people who pay money to personal accounts?
in fact, I'm just waiting to get one case. Then I deal with it once and for all. And you know, there.
How did you stop it?
I called the staff and I told them and I gave them what the law says. And I told them that money should go to the
But they still knew it and they were still taking the 1,500.
It was a collusion. And you'll be shocked. I can't mention names. I was even shocked by people who are pleading with me to stop that, to just let them continue. And I will not mention names. But that one must have to stop. And I know that mortuary, when you do that, people will start threatening you. Oh, and I was even told that that's a very sensitive area. Don't touch. So how sensitive? People are dead there. So
Did you touch?
I've touched it.
Did it have fruits?
In fact, you will see, in fact, the revenue for this month in that mortuary will be more than whatever they've been collecting. Because the reason I asked, because I have experience in other mortuaries. You know, I was not just employed the other day. Now I asked, are you sure this mortuary can only collect this amount of money per month? How many? I went and counted beds, the cubes. Then I said, no, there's something wrong here. First, when I went there, I was given wrong number of bodies. The day I was there, I was told about 30-something bodies. When I went physically, they thought I don't have experience in that. I counted bodies. It was more than double. I counted each and every fridge. I said, I open here. How many? And then those ones which you are supposed to dispose of, I also counted. So you see, if you know what you are doing, people will not like you. But did I come to Vihiga for people to be liked? I'm serving two people. I'm serving the patient and God. And those are the only people I'm serving.
What is your last message to viewers and the last message to the people of Vihiga? And of course, you just left Kakamega the other day at the General Referral Hospital. Probably you can. Have you received referrals from Kakamega where you left?
I can tell you they are coming. They're coming. And okay. In fact, it was raised by my staff who are complaining that there are very many referrals from Kakamega. So, and you know, you cannot deny anybody's service. But I don't know whether they're coming because they know I'm here or they're coming because they lack services elsewhere. But not only Kakamega, other counties. So, personally, I'm focused. My eyes are on the ball.
Okay, your message to the residents of Vihiga and the bloggers as well.
My message to the bloggers, please don't be used. If you have any issue, my office is open. Come and you might come and help me, because out of the things you write which are not true, I might assume all of them are not true. Maybe one day you will be talking about the correct thing. So you people, let us work together. You are our friends, and you need this hospital. You know, when you are sick, you will not decide where you are taken. If you get an accident at Mbale or Chavakali, you will not tell people that I want to go to such and such hospital. You will be taken by police, or we'll send ambulance, will bring you to Vihiga Referral Hospital. So my message is, let us work together, I'm willing to be corrected where there are messes. And as I've said, there are cartels. So you people help me fight cartels. Don't fight me, or don't fight unnecessary wars which cannot be realized. The second one, I'm pleading with people. Just have positive attitude. People of Vihiga and beyond, because that just was not only serving Vihiga. Please come and get treated at the Vihiga, get services. If there is any problem, my office is open. And I've told my staff, including my secretary, one person I will stop anything I'm doing to listen to is a patient. And my secretary knows, and people who are surrounding me. And I'll never allow myself to be cheated by people who are surrounding me. I want to listen to the patient and relatives.
Okay.
Yes.
That has been Titus Mumia, the CEO of Vihiga Referral Hospital in Western Kenya. Of course, he worked also at the Kakamega General Hospital, and now just serving his fourth month at Vihiga Referral Hospital, hoping that everything is going to be okay. The only thing we can do is wait, watch, and test. And of course, for those guys who will walk to Mbale Hospital, please come out with feedback. If you've been attended to well, please talk. If there is a challenge, please talk. My name is Herman. See you again next time.